enough time here to really, I think, wrap our heads around the topic, which is to understand for the next 4 years what we probably are facing in terms of our needs around worker health, safety, and well-being, and some of the ethical issues that have been brought to the fore, both politically as well as through COVID. And so it's a distinct pleasure for me to introduce Dr. David Michaels. Many of you probably already know Dr. Michaels. I've known David for many years, and I've been grateful for his co-mentoring through the years in the field of occupational safety and health. Dr. Michaels is the former Assistant Secretary in the Department of Energy over occupational safety and health for the Department of Energy, and later went on to become, I think, David, the longest ever lasting, I don't know how to say it, but the longest surviving a Deputy Assistant Secretary for OSHA in the Department of Labor.
Assistant Secretary of Labor.
Assistant Secretary, excuse me. And I also am happy to welcome Dr. Matthew Winia, who's a professor here at CU and director of the Center for Bioethics and Humanities at the University of Colorado, who those of you who have been following some of the issues around COVID would certainly be very familiar with what he's been contributing to our thoughts around some of the ethical challenges that we face. So we're going to get right into it. And just to let people know, we are going to have an opportunity to be taking questions. We ask you to use the Q&A box. But we're going to have this really try to be a conversation around today's theme. And to kick things off, we're not doing formal presentations. There's no PowerPoint here. This is really a conversation. And so thank you both for being here today. I think to really kick it off, we're now past Election Day. Certainly some things are still working their way through the political process, but we know that there are years ahead that will be reshaping our thoughts around worker health and safety. I wonder if we could start with having you, David, kind of kick us off with some of your thoughts on what we've seen happen. And just kind of a preview of what we're going to talk about this next hour. Where do you think things are likely headed in terms of worker health and safety in this country?
Well, Lee, first of all, thanks for inviting me. This really is an important moment to be thinking about sort of the next stage. COVID-19 has been it's a global pandemic. I mean, that's a redundancy, but it's affected the world, it's affected the United States, and all aspects of the states. And we'll talk about work today, but obviously this affects schools and healthcare, et cetera. It's a worker safety crisis. And because there are so many other crises going on, and this is part of this larger one, it perhaps doesn't get the attention that it might deserve. But the numbers are really sobering. And of course, we don't have complete data at all because we don't really collect good information about work and exposure. But, for example, the Medicare system asks nursing homes to send reports of either residents or staff being infected or killed by the virus. And just in part of the pandemic period, nursing home owners and operators have reported 365,000 cases, confirmed or suspected cases of COVID-19 among staff, and 1,000 deaths. And the numbers are probably much higher. And we know that from meat factories where there are tens of thousands of workers who've been infected, and other workplaces. So this is just one of the aspects of it. But one of the reasons we don't talk that much about it is because it hasn't been a national focus. The federal government really hasn't made protecting workers a priority, even though there's this huge priority of reopening the economy and getting people back to work. So that's to say it's inconsistent is an understatement. I mean, it's totally discordant. People are afraid to go to work. Many of us are fortunate enough to be able to work at home, and many other people have lost their jobs. But people who are going into work every day, especially in settings where they're exposed to other people, because people are the vector in this case, are terrified. And we want to be able to open the economy, expand the economy, to get incomes back, for so many reasons. But what we don't have from the federal government so far is a national plan. I mean, that's before you can take steps, you need a plan, and there is no plan. There's no overall thinking that's going on saying, what are we going to do? Obviously, some of us have thought about that a lot, but we think what we should have seen over the last 8 months is the president of the United States saying, this is what we're going to do to make sure workers are safe because we need the economy to function. And we also need, it has to be beyond OSHA, the agency I ran. I think we have to be thinking about an all government effort, led by the Labor Department, but you can be very successful involving other agencies. And I think that's what we're going to see hopefully into the future. The USDA is present in every meat factory and poultry factory, but they essentially defer on safety to OSHA, and they just let the meat and poultry companies do whatever they want. And then the result is these many, many deaths and infections we have. CMS has great power over nursing homes, but they haven't really stepped in about safety. So I think what we haven't seen so far is an all government effort. And I think hopefully we'll start seeing that, certainly, if not now, starting in January.
There's been kind of this, I would consider it probably a false choice between economic prosperity and worker health and safety, and even community safety during COVID. But Matt, I'm wondering, putting on your hat as a bioethicist, how do you kind of size up where we are in terms of the current situation?
Well, I mean, first of all, thank you for having me today for this conversation with David Michaels. I'm just honored to be on the same screen with him. So I really appreciate the chance to have this conversation. And I'll start by building a little on something he alluded to, which there's a saying in bioethics that good ethics begins with good facts. And the reality of the current situation is we don't have the fundamental, really basic data on which to gauge how poorly or how well we are doing. I think we all understand that we're doing much worse than many other countries with regard to the COVID pandemic in general. But there is no national standard data system for tracking how many people in healthcare even are catching COVID at work. We've got a few, studies here and there that suggest maybe healthcare workers have about a 3 or 4-fold increased risk of catching COVID compared to others. We've got data from prior pandemics or epidemics, outbreaks, right? The SARS epidemic really affected healthcare workers very much disproportionate to the general public. Same with Ebola. My most terrifying statistic on that was the Liberian experience with Ebola, where 8% of all the doctors in Liberia died. So we know when epidemics arise, healthcare work becomes more dangerous. And there's a whole ethics around that. The fact that when we sign up for this job, it's a public service profession. And we know that sometimes we may be asked to take risks. But the fact that we don't have a system for tracking the extent of those risks in the way, by the way, that we do have a similar system for tracking, how many cops are killed in the line of duty, how many firefighters die in the line of duty. OSHA tracks these kinds of things. We actually don't track how many people catch infections, with a couple of exceptions, which David could probably speak to more than I can, but the bloodborne pathogens has been sort of a carve out with regard to infectious risk at work. So I think I've gone off track from what you originally asked, but I just wanted to sort of reinforce that we're really operating not exactly in a data-free zone, but in a very data-impoverished zone when we're talking about how many people are being infected at work and dying as a result of this. And every part of what I just said could be parsed out. And maybe we'll get a chance to parse some of that today.
David, pitching it back to you, when you were at OSHA, one of your major thrusts was around reporting and around the data. And I'm wondering what your thoughts are.
Well, that's right. I think one of the ways we thought about making OSHA or making worker safety more important was to change rules around recording and also reporting. OSHA is a really small agency, and OSHA can't, even under good conditions, in other words, before COVID, OSHA inspectors could get to every workplace. I think the estimate was once every 165 years. So how do you then engage employers who you're not inspecting, because you expect them to abate hazards as well? So we changed a bunch of the rules around. We issued new regulations requiring employers of a certain size in many industries, not all employers, but many employers, to actually report the summary data from their OSHA logs to OSHA. And the plan was to put it on the web, with the idea that if people could see the rates of injuries in different workplaces, they would treat those companies differently. Prospective employees might look elsewhere, for example. And that would encourage employers to make their workplaces safer without actually OSHA inspecting. Unfortunately, that was one of the regulations the Trump administration they didn't roll it back particularly. They just said they're not going to enforce it. And they finally did lose some court cases. And now a lot of that data, at least from a couple of years ago, is on the web. Similarly, we changed the rule that said severe injuries and hospitalizations have to get reported to OSHA. And that's unfortunately recently gone through a change, hard to believe, but the Secretary Scalia, Eugene Scalia, who runs the Labor Department, actually has decided that to reinterpret the regulation that says that if a hospitalization occurs, you only have to report it if it occurs within 24 hours of exposure to the virus. Of course, no one knows when people are exposed to the virus, and also no one is hospitalized within 24 hours of exposure to the virus, because it takes longer. And so OSHA is actually learning less, and the public is learning less about what's going on in workplaces as a result of these things. So I think actually that's one direction I'm hoping that OSHA in the future and other agencies go, understanding some of the learnings of the behavioral sciences, and that by public disclosure of information, it impacts employers without OSHA inspecting, which of course is what they would want as well. That you're getting some better conditions with no additional resources and without the inspections. But we'll see. I mean, right now, it's really a data vacuum. We don't really have much information on what OSHA is doing. OSHA has stopped even issuing press releases about their inspections. It's really, I think, a disaster. But these are things that can be easily remedied, because they're temporary changes in policy that will disappear hopefully after January 20th.
Well, I think your point's important, that this is not, and we're not going to just talk about OSHA here today, but it doesn't, it's not lost on us that OSHA's had more than 10,000 complaints, and to date has issued something less than 200 citations, as far as I know, and many of them, relatively small, and many of them probably will be disputed. But you're kind of continuing on this sort of theme of how do you identify with COVID whether you even have a work-related case of COVID, is something that I'd like to pitch back out to you all. And we're starting to get reports that whether it's in meatpacking or whether it's in healthcare, for example, that employers and insurers, and on the workers' comp side of things, workers' compensation insurance is an automatic denying claims for work-relatedness. I'm wondering, is the workers' comp system just telling us again that it's broken when it comes to diseases that are related to the workplace, or is it just too complex?
I mean, this is a particularly difficult case, right? Because it's difficult to completely disentangle the exposures someone might have in the workplace and in their community or at home. And it requires a good deal of specialized expertise, maybe even including genetic analysis of the virus to make clear determinations. But even contact tracing work is kind of specialized within the healthcare system, because a single individual working in an environment where there's a lot of people around you, patients, who have COVID. So the questions are not just how many people were you in contact with who had the disease. The questions are around, and what kind of personal protective equipment did you have available to you, and were you using, and were you donning and doffing that equipment properly? And so the contact tracing challenge here is kind of specialized to make a determination whether someone in a healthcare environment was infected at work. And if it was at work, was it by a patient, or was it in the cafeteria by one of your coworkers, or was it at home? And if it was at home, maybe, you know, your spouse is also picked it up at work, right? Or your friends picked it up at work and now transmitted it at home. So they're both important to separate, and they are disentangleable at the same time. And again, this kind of gets back to, we don't have great data to be able to track this. And if we wanted to take it seriously, we would need contact tracing teams that were specific to the healthcare environment, that would be trained specifically to make these kinds of determinations as best they can, and then to use those data to intervene and to prevent further spread of infection. To your question, Lee, about the workers' compensation system, yeah, it's broken. And this is, maybe this will be the thing that really puts it over the edge. But the idea, from a societal standpoint, that the primary way in which people who get injured at work get any level of compensation for that is through this sort of Byzantine system where you have to prove exactly how much of the injury was as a result of the workplace environment. From an ethical standpoint, it doesn't really make sense. I think from a societal standpoint, if you believe in the sort of values of the Enlightenment, that the purpose of government is to ensure the well-being of the entire citizenry of the populace, you probably wouldn't set up the workers' compensation system the way it's currently set up.
Yeah, no, I totally agree. The system is broken. When you have crises like this, it exposes just how bankrupt it is. This was a disaster before COVID also. Just there's been a race to the bottom. But around diseases, you have this focus on proving something that you could really only look at probabilistically. And if you take, some of these meat plants, for example, where the employer, like JBS, is automatically just denying every claim, you're in a community which had, over certain months, a COVID case rate of maybe 10 or 15 per 100,000. And you had a plant where the rate was 10,000 per 100,000. Yet they still say the exposure couldn't have occurred at the workplace and have grounds to fight it. So, it's of course absurd, but they are likely to be able to get away with it. And it's one more thing that should be on our agenda to fix, to protect working people in the United States.
Oh, go ahead, Matt. You're going to say something.
I just want to reflect on this race to the bottom concept, because I think that will come up maybe more than once in the conversation today. I'm thinking about your earlier comments, David, about OSHA and their unwillingness in the recent past to issue, and even in the more distant past, it's been very difficult to get regulatory standards as opposed to recommendations, advice, guidance, which is all voluntary, and which workplaces may or may not choose to follow. And we've got lots of evidence in the COVID context that workplaces are choosing not to follow the guidance sometimes. And unfortunately, it's easy to demonize, I think, the employer for that sort of misbehavior or poor behavior. But the reality is the good actors are economically punished.
Absolutely.
For doing the right thing. Right? If it costs something to live up to a standard, you can't issue that as a voluntary standard and really expect everyone to do it, because those who do it will end up going out of business, and it will only be the bad actors who can stay afloat. And so I think again, it's easy to demonize the employers for failing to live up to the guidance, but the fact that it's mere guidance forces them to not live up to it, or they'll go out of business, right? Because they're in a marketplace that's competitive. The reason for standards is to establish a level playing field where the race to the bottom is truncated, because you've laid a floor and said you cannot go below this. So the race to the bottom goes only to here, and that's as far as it gets.
Right.
Well, I want to kind of steer our conversation in a direction that's coming up in some of the questions, and I want to tell people that we will have time to come to the questions, but to kind of direct this conversation a little bit into the near term issues that are arising, and then let's look out further into the future. And in the near term, most recently, one of the I think things that we have to be confronting is that, first of all, we know that that there have been significant racial, ethnic, as well as gender disparities that have come to the fore through COVID. Things that already were existing in society, right? We already knew that disproportionate numbers of people of color are injured on the job, for example, and now we have with COVID that being amplified even more. We are seeing an exodus of women from the workplace because of competing activities that they have to maintain their families and their homes, and just structurally, the society still puts more of the weight on women for maintaining the family and the kids who are in and out of schools, et cetera, compromising their role in the workplace. I'm wondering if you all have some thoughts about how we cope with these kinds of inequities, these disparities that are being highlighted by COVID.
Well, I mean, certainly these weren't, so high profile. It's always been the case that workers of color, many of whom are women, did this really important work to keep our economy going, to keep us fed, to take care of our children and our elderly, and they were invisible. And now they've become visible because we're in crisis, and so many of them have been impacted by this. The question is, how do we make sure into the future that they're protected and better, and essentially receive living wages? The failure to do that has certainly exacerbated this epidemic. And we've seen, for example, that so many of the people who do care in nursing homes or home care work several jobs, and they're at risk themselves because of comorbid conditions. But there's evidence of them spreading the virus, of course, because they go from workplace to workplace. And you could see how these economic disparities that impact public health and affect everybody, just like the infectious disease does. And so hopefully, as we recover from this, we'll talk about things like a higher minimum wage for everybody, the $15 or higher wage, and certainly for those important jobs of taking care of people, they should be higher. Issues like that, and sick leave, all of these, which are basic benefits for workers. You could see in this pandemic how they're very impactful. If people don't have sick leave, they come to work sick, and they're making other people sick. I mean, it really is very clear that if we want to protect everybody, we've got to bring up the standards, the workplace standards, the living standards for the whole population.
Yeah, I'll just say, historically, some of the most important advances in social policy have arisen in the wake of epidemics. And this goes all the way back to, Virchow and his study of typhus in Upper Silesia and his sort of radicalization through this experience where he came to I don't know if it was an epiphany, but I like to think of it that way, that he had this, epiphany that the environment, the workplace, and the well-being of individuals and communities are all connected. And if you want to affect one, you have to look across all. And this is, the basic framing of public health ever since, as a science and as a policy arena, right? Public health sits uncomfortably sometimes at the nexus of science and politics. And that's because of this fundamental recognition that when you're talking about the health of communities, you are not just talking about, individual medications and individual vaccines, and you're talking about how we all relate to each other and how power is distributed, how goods are distributed, how resources are distributed. So today, looking at how states are developing policies for the distribution of scarce resources in the event of an enormous surge of patients with COVID, as we are currently experiencing, right? Our policies in Colorado now, and this is true across the country, many different states, are looking at these triage policies. And we are all looking very explicitly at how do you make sure that resources are directed to the communities that are being hardest hit by this virus, and that the resources are not all sucked up by the people with wealth and privilege who normally get most of the resources. But in this environment, we actually have an opportunity to be very mindful of, in a shortage situation, how do we make sure that the things that are in shortage don't just go to the wealthy and the well-off, that we actually direct the things that are scarce, whether it's vaccines, whether it's novel, experimental type treatments that are, recently approved, that kind of thing. We can direct those to the workers in nursing homes, as an example. And that's a very explicit thing that we're now talking about and planning towards.
Well, let's dig into that some more. So let's take the vaccines, for example. We have some promising news. I don't want to get too far ahead of ourselves here, but we have some promising news around potentially effective vaccines. It's going to take a little bit more time for that to mature and get through the FDA. But already people are talking about how do we, as right now, a restricted, limited resource, how would we distribute vaccines? Not how, but who would we vaccinate first? And I'm interested in both of your thoughts around that particular issue. Who should get the vaccines, and where do workers and which workers fit into that? David?
I'll start. I was on this National Academy of Sciences, Engineering and Medicine expert panel to recommend to the federal government a framework for the equitable allocation of the vaccine. And it was a fascinating process. And where we ended up after looking at all sorts of statistics and different considerations was to put at the very front the first group to get vaccinated, healthcare workers who are at risk. So, it's interesting, not all healthcare workers are at the same risk. Those nursing home workers and home care workers in some ways are at the greatest risk, and they are also at risk of spreading the disease to their patients or their clients. So we said that given there has to be a phasing in, because we're not going to have lots of vaccine at the very beginning, the theory is we'll have 3 to 5% maybe by the beginning of the year or January, and then over the next few months, it'll roll in, and it could be 8, 9 months or a year before we have enough for everybody in the country, depending on how many vaccines, productions, et cetera. Those workers should be first. By the way, we know that you could protect some healthcare workers who are not at great risk, and it's sort of good news, but shows what we could be doing and we're not doing. There just came a study out of Norway that was really interesting, where they have great data. They have occupation on everybody in the country. And they looked at the first wave and the second wave of COVID-19. The first wave, nurses were at hugely increased risk, 4 or 5 times the risk of other people in the population when they weren't adequately protected. By the second wave, the risk of nurses was far lower than average in the population. And so we know that we don't necessarily have to vaccinate everybody in the healthcare system at first if they're protected, but we want to make sure the people who aren't getting the PPE, the people who are living in workers who are living in home with other people who are at risk, who take public transportation, they all need to get vaccinated first. along with people, older people in congregate settings who really are at great risk of dying. More than half the people who've died of COVID are essentially nursing home and long-term care residents. Beyond that, in the next group, we talked about these essential workers. Not every essential worker is exposed, but those who are working in situations, putting themselves at risk, making sure we're fed, working in grocery stores and meat factories and driving buses, et cetera, where we clearly see increased risk. After that, it becomes really sort of an interesting question. There are other workers who are coming back to work and are at risk in restaurants, in gyms, and in tattoo parlors, the theater, sports. And at that point, it really becomes a question of values. I mean, what are the important functions for society? Is it more important to have the theater or to have bars open, for example? We put teachers, by the way, up in the second group with those essential workers because we need to get schools open, but we didn't put university professors, looking around this room, in that group. We know that our students can study online for the most part, and they're doing that fine. But maybe that college experience is more important than other things. And so that's one where we really, this is an opportunity to have a values discussion in the economy, in society, and say, whose job is important, and that what should follow that is, are we valuing, are we paying people, are we rewarding them adequately for the work that they're doing? Because if it's really important, they should be adequately compensated for that work.
Matt, thoughts?
Oh, sure. Lots of thoughts. I'll start with a minor thought, but just a language issue. I think we often hear the phrase essential workers, and it's probably more accurate. And maybe I'm showing my cynicism. It's probably more accurate to say workers in essential industries.
Absolutely.
Just because the way we have actually, as a society, treated those workers is as disposable on an individual level. Their industry can't go down, right? So when in April, the president said, you can tell your meatpacking workers that they must show up at work, even though the virus is rampant in your meat processing plant, that suggests that the industry is what's essential. The workers are being treated as disposable. And then, so that's one comment, and then it's sort of a side comment. But the other one is, I think, I'm a fan of the National Academy's report. I think it is really very well done. And it reflects a couple different layers of values, right? So the first layer, which is the most common one that we always talk about when we talk about distribution of scarce resources in healthcare, is trying to save the most lives with the limited resource you've got. And that sort of utilitarian value structure is very important. And that's why you would, for example, give top tier priority to healthcare workers, because they're more likely to get infected, they're more likely to pass it along to others. Plus, if you can save them, maybe they continue and go on to save other people. So you get sort of a threefold benefit by vaccinating people in that top tier. And then you kind of go, down from there in terms of how do we capture this sort of multiplier effect? Who else, without becoming, strict utilitarians who care only about this? Because I think pretty quickly the National Academy's report acknowledges that being a strict utilitarian is not what we all want in the end. It's a very important thing, saving the most lives, but equity is really important too. Preserving a functioning society in the wake of the disaster, that's pretty important also. And that may mean that you actually have some trade-offs between the most efficient use of this limited resource and the most equitable use of the efficient resource, and the way in which society can recuperate in the wake of the disaster. And that is what leads the Academy's report, for example, to give some level of preference to people who live in neighborhoods that are hard hit by the virus. right? That may not, in all instances, be the most efficient use of a limited vaccine to just save the most lives, but it's certainly not the least efficient also. And it gives explicit value to the notion of equity and reciprocity. These are people who live in a neighborhood where they can't avoid this, where they're going to work doing these jobs that we all, that need to be done and that are at this point risky. It's nice to think that they might not be exposed, but I'll tell you, in Colorado today, if you are a grocery store worker, you are guaranteed you are being exposed to infected people every day, because 1 out of every 100 Coloradans today is infectious with COVID, and half of those people don't know it. So if you're a bus driver, if you're a grocery store worker, if you're in any kind of a public service industry, you are guaranteed being exposed to COVID every day. So, wear your mask.
The vaccines themselves are going to be an interesting evolving issue for us in terms of as a society prioritizing by values how to distribute that. There's also a presumption that people are going to want to be vaccinated, and with the level of misinformation, disinformation that exists right now, it's not a given that those communities that you're talking about, Matt, are that everyone there is going to be receptive to a vaccine. So there's some other serious issues we have in terms of the seeding of doubt. It's not an accident, David, that I use the word doubt, because I use your books to teach my classes in the School of Public Health. I'm wondering if we can. I want to come back in a few minutes to this topic of limited resources and get back to things like PPE, for example. But I want to take a moment and follow through this example of vaccines. Let's say that we can follow the National Academy's recommendations and get the distribution that we need. Where does the seeding of doubt and misinformation play into the response that we have to the COVID epidemic? And what is the role of, let's talk politics. What are the role of our politicians and of our government in helping to address that? And David, I want to turn to you.
Yeah, well, you've raised obviously the right question. Right now, there's a huge amount of vaccine hesitancy, and there are at least 3 different strains. One is just general. The polarization in the United States is such that there are some people who look at who's ever, the other party, they just don't trust them. That's relatively recent. We have a large portion of people, primarily in the Black community, who are suspicious of the medical system because of past, scandals and outrages, and getting back to Tuskegee and others, where people say, we don't want to be the guinea pigs in this situation. We don't trust what we're being told. The third area, and this really relates to the work that I've done in my various books on the manufacture of doubt, is the sort of anti-science, anti-intellectual tendency, which really has been fed by the tobacco industry and the fossil fuel industry. And it's actually been pretty well documented that you have these organizations that question government intervention on things like tobacco or fossil fuel. And it's very difficult to say we don't think the government should act on something that is causing death or severe hardship. And so it's much more effective to question the science, because if the science behind tobacco isn't there, if tobacco doesn't really cause lung cancer, which for years they were trying to argue, or if fossil fuels aren't leading to accumulation of carbon in the atmosphere and then the climate crisis that we're currently seeing, if the science is wrong, then you don't have to talk about what to do about it. And those industries knew that very well, and they seeded a small number of scientists to make that claim, but more importantly, they seeded these sort of astroturf type organizations that look like they were real, but really funded by them, around the Tea Party, for example, which those industries really started. And then they gave huge amounts of money to the Republican Party. And so it became really a necessary qualifier to be a Republican, to say that at one time you questioned tobacco, many of them did, but certainly to question climate change. And if you question those scientists, you put out this general view that, well, these academics, these scientists, these pointy heads, they're in it for themselves, the people who are in public health science in particular, environmental sciences, and don't believe them. And that really has fed, I think, a real important anti-science, anti-academic tendency in a significant portion, 20–30% of the population that's believes that climate change is a hoax. And of course, that extends, I think, to looking at these issues. These same people, and I think this has been pretty well studied, also believe masks are ridiculous. In fact, maybe this whole COVID-19 thing is a hoax. And there are plenty of folks on TV who encourage that. And it's like it's really, these two industries planted the seeds to do this and then paid the Republican Party to take this position because it led to very great wealth on the Koch brothers and Exxon, et cetera. And now the world is paying the price. And it's going to be very hard to turn that around. And I think a lot of Republican, to be very clear about this is who we're talking about, politicians are so deep into this that it's very difficult for them to jettison these beliefs that they've sort of held and expounded upon in their careers. But this is leading to this question saying, well, we don't really believe the vaccine, we're not going to take it, we don't think this is a real problem. And of course, because of the public health nature of this, the more people who don't get vaccinated, the greater risk for everybody. But look, it's, some of us might think, as Miami gets pounded by, how many tropical storms and the water rising, you'd think that might change people's views, but there's no evidence that those the sort of facts on the ground actually change the way people look at the world. So we have to think about what's the best way to get this information out in a way that really people are willing to take the necessary actions to protect themselves and to protect others.
Matt, the ethics of disinformation.
Oh man, I mean, I really can't. I really can't improve on what David has said in terms of, both that brief history of the merchants of doubt or the manufacture of doubt, the sort of doubt, the clear recognition that doubt is a product that can be created and sold and marketed, and that it has these benefits to discrete industries, and the whole infrastructure that has been built up. And the only thing I think maybe to be said is that this is really coming back to bite all of us, including the people who use this cynical strategy, right? It was a bad faith cynical strategy that was adopted as an explicit approach to a set of policy issues, and it is now killing lots and lots of people, including the family members of the people who manufactured doubt about cigarettes and all kinds of pesticides and oil and gas and the climate crisis and so on. And it's built on in some ways it's built on the fundamental nature of science, which is we are as scientists, we're actually kind of cautious about certainty. Karl Popper famously said that science can never be certain about anything. All we can do is, disprove things. We can't actually prove things, which a little bit of an oversimplification, but there is a sense in which whenever we write a paper, we always have the limitations, and we always end with more research is needed. And that leaves, a gaping hole for merchants of doubt to drive their truck through. And I don't know how to fix that, because I think science is what science is. And in the long run, the truth will out. If we keep doing research, the problem with, things like the climate crisis is that the truth is happening all around us now. And still folks are having a hard time seeing it. So it gets almost to this cult problem of when people become so indoctrinated into a belief system that it becomes a part of who they are as a human being and a part of their identity. The notion that, there's a deep state that is fighting against, right? The whole QAnon conspiracy theory thing. it's really hard to see how you get people to back out of that. Not impossible. People do leave cults, but it's a difficult thing. Once a belief system becomes attached to your view of yourself, and your personal integrity is wrapped around this belief system.
I think we're going to have to do a future session just talking about climate change, belief systems, and the worker, because we now recognize that workers themselves, especially agricultural workers, construction workers, and others who do heavy labor outdoors, have been referred to as the climate canaries. But I want to come back to this belief system issue, because we're facing it every day with mask use, and we have a number of questions that have come up around mask use. And I'm going to present to you a scenario going back, Matt, to something you mentioned about grocery store workers. We're in our center, we're doing a lot of work now trying to help businesses protect their workers. And one of the things that a grocery store worker would benefit from is universal masking of anybody and everybody they come potentially in contact with. So every customer, for example. A customer not wearing a mask potentially represents a direct threat to the health of the worker. In that scenario, we're starting to have some challenges come up where we have people who, are customers who say, well, I have a disability and I cannot wear a mask. Or maybe even more simply, I choose not to wear a mask, and you need to admit me to your store. How are we supposed to balance the competing needs of people who have, for whatever reason, let's take disabilities, for example, who have legitimate reasons why they can't comply with what we see as a very simple public health measure that we know can benefit everyone, including workers? How do we set that against the needs to provide a safe workplace? And David, maybe if you want to play with that idea a little bit, because it's very real right now.
I think this is more of the ethics world, but from the OSHA point of view, I think one of the things that businesses need are, as Matt said earlier, they need these clear rules because they don't want to be seen as enforcing an arbitrary policy. This came up in the airlines. The airlines actually asked the Department of Transportation to require masks for airline passengers. And they were joined by the pilots union and the flight attendants union for obvious reasons. The Elaine Chao, the Secretary of the Treasury of Transportation, Mitch McConnell's wife, said no, she wasn't going to do that, that this was a labor management issue and should be subject to negotiation. But of course, those of us who are airline passengers are not part of that labor management negotiation. But the airlines desperately need people to feel safe in their facilities, or people won't fly. And the same is true for stores. So I think if you have that minimum requirement and you say, okay, let's think about what we do for people with disabilities, because we make accommodation and we have to think about what that is. But the basic rule saying you don't go in a store where there are other people if you're not wearing a mask is a straightforward public health rule. And it's only going to work, though, is if everybody understands that the government is saying it, it's not the store owner. So the focus of the angry patron isn't on the worker or on the store owner, but it's on the government, and let them bring it up that way. But I think that's what we need to be talking about, saying this is the rule for everybody, and let's think about how do we accommodate people who have a need to be accommodated, but it's not a personal choice question. Just as we say, for example, the government says you can't have 10 drinks and drive. You can think it's a personal choice. I don't care if I get injured, but that's not why we say that. We say that because we don't want you to hurt someone else. And that's the mask issue. But of course, we don't have politicians yet who are sufficiently explaining it in that way. And that's what we have to be talking about. That there are certain rules right now that everybody must follow. And if you can't follow, let's figure out a way to help you because you have a disability or something. But just this idea that you don't think you have to wear a mask should be no longer acceptable.
I thought, by the way, you had a wonderful piece out within the last couple of weeks, David, where you used the analog to construction workers and helmets on construction sites. And, of course, there will be construction workers who feel uncomfortable, who would rather not wear a helmet, who will take their chances. That just doesn't happen because it's a rule.
That's right.
And the employer can be fined if a worker is walking around without a helmet. And by the way, that is one of the sort of libertarian, there's actually a real libertarian argument against requiring helmets, that you should let people, right? That's a legitimate libertarian thing. You should, if I'm willing to take the risk, right? Because the arguments on the other side of that would be, well, the community is harmed if you get bonked in the head and end up brain damaged and we all have to pay for it. Well, you can make that kind of an argument that others are harmed if you get hurt. But really, it's mostly about protecting you. When you go to things like the mask, it is much more analogous, I think, to your metaphor of, I should have the freedom to drink while drunk. To drive while drunk. Or, by the way, I should have the freedom to make my own speed limit. Right. Well, why does the government get to tell me how fast I can drive? I ought to be able to drive however fast I feel is safe. Well, the reason we have a speed limit is not to protect you, it's to prevent you from hurting other people. And that's closer to where the mask mandate, I think, falls, is it falls very nicely, actually, within the parameters of a libertarian political philosophy, right? The original libertarian, John Stuart Mill, framed this as the harm principle. He said the only thing that a government should do to constrain your liberty is to prevent you from harming others. This is usually articulated as my freedom to swing my fist ends just at the tip of your nose. And the moment that your libertarian instinct causes you not just to hurt yourself, but to start hurting others, that's when it's legitimate for the state to constrain your personal liberty. And so I have a hard time with libertarians who don't understand their own political philosophy, but there are a lot of them out there, I think, who believe that, libertarian political philosophy means I get to do whatever the hell I want and who cares about everyone else. That's actually not libertarianism anymore. That's anarchy. It's a different political philosophy.
So I'd like to see us pivot a little bit now in, further out into the future. And if we could, and first of all, I want to point out to people, if you haven't tracked this down, there was a very nice piece that David Michaels and another good colleague of ours, Greg Wagner, wrote recently last month on halting workplace COVID transmission. I thought that was a really very insightful piece with a lot of very, I think, solid recommendations. If I were talking to the president-elect, I would recommend that they take a good look at some of those recommendations. But let's look a little bit further out in terms of what we see as maybe a little bit of a compare and contrast, David, where we've been going back to the Obama administration in terms of worker health and safety, where things have gone in the last 4 years, but then let's pivot and talk about what's the work ahead. What should be the priorities?
Well, there are really two different ways to think about. First, obviously, around COVID, and that's really what Greg Wagner and I laid out in our report. There are a number of things that need to be done immediately, and I think they will have a big impact. But I think it's reasonable to think another year from now, COVID will, to some extent, be in the rearview mirror. It's not going to disappear, but we won't be as worried about it. Hopefully, all the vaccination programs will work, and we'll just be in much better shape. But the bigger issue, though, is worker safety in general. And this is just one more area where the crisis has exposed really, the weaknesses of our system of protecting workers and the tremendous toll that work takes on workers. When we're now focused on these poultry factories, for example, but they have, remarkably high musculoskeletal disorder rates. I mean, 40-50% of the workers become seriously hurt as a result of their repetitive motions there. So the way I've been thinking about this, looking back over both the last 4 years and the last 50 years, because actually OSHA's 50th anniversary is coming up next month, is that OSHA made a huge impact, compared to where we were in the 1960s and the early 1970s. Things are far better. There was carnage in the workplace in those days. I mean, there were 37 deaths every day in the American workplace. And now with the workforce more than twice as large, we're down to 14 deaths a day, but still 14 deaths a day. That's nothing to sneeze at. And you look at the last 4 years where a lot of the agencies, including OSHA, have really, suffered. In some ways, I think we should be thanking President Trump. He did great damage to OSHA, to the EPA, to some of the other agencies, but they weren't so good before. The OSHA standard setting process, as we've talked about, is really dreadful. We put out a standard for silica exposure that took 20 years. We issued a standard for beryllium exposure probably 15 years after the one that Lee and I worked on at the Energy Department that came out in 2000, and we issued it in 2016. It's a system that doesn't work, and it's not. It's true across the board. Look at the Boeing 737 MAX jet debacle. The FAA under Democratic and Republican administrations had really outsourced safety oversight to Boeing, and that's a mistake. And we really had this terrible crisis that killed 360 or so people, and had a big impact on Boeing, its shareholders, its workers, and the entire airline industry. So we need to rethink the way we do regulation, the way we do public health protections. And in some ways, because of what President Trump has done to really hurt these agencies, now is the opportunity to say, how do we do this right? How do we rebuild the agencies so we have different, we don't, for example, OSHA has to wait for people to die from a chemical exposure or to be very sick before we can regulate it. And so we have these chemicals where we don't have much data. Let's say these fluorinated compounds, the PFAS chemicals. They're, if you've seen the movie Dark Waters, for example, you've seen that, and there's very substantial epidemiology on 2 of these chemicals that went into making Teflon and Gore-Tex and Scotch-Guard, and we know that they're quite toxic, those 2 chemicals. But in the category of chemicals, there are 9,000 different compounds, and we have good data on 2 of them. And of course, those 2 are almost never used anymore, and people switch to these other ones. We can't wait for more bodies in the morgue to figure out if they're toxic as well. So we have to rethink how we protect people from these occupational and environmental hazards. So that's in some ways the challenge once we get past COVID.
Do you think that this is the opportunity for us to tackle the existential threat of climate change in relation to worker health, David?
Well, that was years ago we should have, but we still have to. Certainly, heat will be an increasing problem, and of course OSHA has no heat standard. But a standard alone isn't enough. We obviously need to be that just says when it gets really hot, you give workers more rest and shade and water. But really what we need to is, tackle the climate crisis. But that'll take longer and won't, in the short run, we need to save those workers' lives also. Certainly that needs to be a priority, but the priority list for OSHA is a very long one. And we have to figure out how do we jumpstart this agency in a different way and allow it to work in different ways to be effective.
Matt, thoughts on this?
Well, I love the idea of appreciation of the sort of burning it to the ground approach of the last 4 years, that it gives an opportunity for the phoenix to arise from the ashes. I was actually wondering, sort of short and long term. I think the phoenix rising is a little bit longer term. In the short term, what are the I'm taking over your role for a second, Leah, because I have a question for David.
Go for it.
What's a potential role for an emergency standard? I know OSHA has the capacity, at least in theory, to issue an emergency standard when there's a crisis, as every state has declared a public health emergency. Seems like of all the times, this is when OSHA might say, this is the emergency standard. We're short-circuiting the normal rulemaking process in order to keep people safe in this emergency. Is that realistic?
Yeah, this is in the like, don't get me started category. There's no question. I mean, OSHA should have issued an emergency temporary standard around COVID-19 months ago. I mean, I was advocating for it in January before we had our first case here. It was clear that was what was needed. Secretary Scalia has taken the position that OSHA can be a suggestions agency, and that's the way he's run it. I don't think there's any question that President Biden will issue an emergency temporary standard very early in his tenure. He's already said that was part of his platform. The importance of that is employers need to know what the rules are. And I don't know what the standard will look like, but it will probably say something like every employer needs to make a plan and take into account, what we understand about distance and ventilation and masking, things like that. And if you don't do those things, you have to explain why. And it will have a huge impact because standards are a wholesale way to deal with issues that inspections just do on a retail basis. The inspections go one workplace after another. There are ways to magnify their impact, but standards are very powerful because many employers want to be law-abiding and they will follow a standard. And their attorneys and their HR departments, all those people say you've got to do this. So I would think you have to do that immediately. The downside of the current system is that the way the OSHA law works is OSHA can issue a standard for significant crises like this, but it only lasts for 6 months. At the end of 6 months, OSHA has to replace it with a permanent standard, which goes through regular rulemaking. So I think what would happen is OSHA would issue an emergency temporary standard and then use that as a notice of proposed rulemaking at the same time. And the staff would have to go into very high gear and take comments and perhaps have a hearing, and then within 6 months come up with a permanent standard. That will be a challenge. There's legislation in front of Congress passed by the House that would give OSHA 2 years to do that, which is much more realistic and reasonable. But one can never predict what Congress will do these days. So, I mean, I'm hoping and assuming that we'll see an emergency temporary standard in January. And then I think that will be very useful. And then you'll see a lot of talk about what should be a permanent standard. I hope we all participate in that discussion to make a better standard. Also, not just for COVID-19, but for airborne infections. We actually at OSHA, after H1N1, we started the process of pulling together a standard for airborne and contact infections. It would only have applied to healthcare workplaces, but it would be a very similar one. Because it was clear OSHA needs a standard to protect workers from not just coronaviruses, but from tuberculosis and influenza and from MRSA and others. So hopefully we'll see some real progress on that starting in January. It's got to be the highest priority in the short run.
One of the concerning things that I heard on the radio today is that in the federal budget, OSHA is slated to get even some further cuts of an already puny budget. But so where's the?
Well, that was actually just a Republican proposal. That was the Senate Republicans' budget. I don't think the appropriators are going to let that happen, but I also don't think they're going to give them a big increase either, which is unfortunate.
Yeah, but that's it. It comes back to it. At the end of the day, we have, and you said this very early on, David. We have not invested in worker health and safety, either from a research standpoint or from a regulatory and enforcement standpoint. So, do you think that in this burn it to the ground and rebuild it scenario, we're going to have the wherewithal to put the money where it needs to go?
Well, that's a tough question. Certainly, with a split government, it's going to be hard to do that. But money makes a difference. I think the more important thing is creativity and thinking about, the world is a very different place than OSHA was, than the world was 50 years ago. We go into a workplace now, and it used to be that almost every worker there worked for the company whose name was on the door. Now you go in and there are these temporary workers who work for a staffing agency. There are contractors and subcontractors and so-called independent contractors who often are workers who are just, their employer pretends they're independent contractors, and gig workers. And OSHA has limited authorities in different cases. And it really needs to rethink a lot of this, and probably needs new legislation to give it the sort of power it needs. That if people are interested in this, Jordan Barab, who was the Deputy Assistant Secretary while I was Assistant Secretary, and I wrote a piece in the American Journal of Public Health, I think it was last January. And it's not behind a paywall, it's open access, on sort of called OSHA at 50, what, where do we go from here, or something like that. And we try to raise a lot of these issues, saying this is a different country, a different workforce, different workplaces than 1970 when the OSHA law was passed, and we need to rethink that as well.
One of the things, Matt, that we tend to struggle with in our field of occupational safety and health is that there's always a higher priority than workers, and kind of even getting a seat at the table, even at places like the CDC, places where you go like, well, it's the home of public health, is often a challenge. Do you think that there's an opportunity here for us to have the Phoenix rise in a different way for worker health and safety?
I mean, so I like that idea, and I defer to David on the political possibilities of it actually happening. I think he's right. In a divided government, it's going to be a challenge if the political philosophy moving forward is similar to the political philosophy of the last 20 or so years, which has been a pretty explicit political philosophy on the Republican side. And I'll just be honest about this. It's been a pretty open political philosophy of, we want your administration to fail. And the perception of the Republicans is that is the political philosophy that the Democrats adopted with President Trump. Whether you think that's true or not, I think that is where Republicans often sit today, is that they feel like that was their political philosophy for Obama. It didn't work to a great degree, but then it did work for the Democrats when they applied it against President Trump. So that's the narrative. And unfortunately, that narrative leads, the Republicans potentially to come out of this election, assuming the election is as it appears to be, to come out of this election with an unfortunate lesson that it works to be relentlessly obstructionistic. And that's going to be a big problem if we go into the next administration, not just with a divided government, but with a divided government where one half has as its sole objective to see the failure of the other side, and are unwilling to acknowledge that there are win-win scenarios, right? You have to be willing to at least acknowledge that there are win-win compromise scenarios that are worth pursuing for the good of the country, in order to have divided government work. And I mean, I think we know a lot about this actually in Colorado. We have divided government a lot over the years, and have been able to work with each other to make progress on things. But I have not seen that at the national level in the last 12 years, really, since Mitch McConnell first articulated it as an explicit strategy, in January of 2008, when Barack Obama was inaugurated, and he said, we're not going to work with this guy. No one worked with this guy.
So in that scenario, I'm sorry, go ahead.
Well, I still have scars from this, mental scars, from the Affordable Care Act, right? Which President Obama took a Republican proposal and was willing to adopt it even more in a Republican direction, and could not get a single Republican to vote with him on this proposal, which was which basically came out of a libertarian think tank. But more important was seeing his administration fail. And that is, it's sort of a bad faith mindset, but if it works, you might pursue it. And that's going to be the big question mark in my mind in January, is, will the Republicans in the Senate continue to follow the McConnell 2008 strategy, or will they look back on the last 4 years and choose a different strategic path to what they hope might become a Republican majority someday.
So, given this this it's more than a vacuum. Maybe it's a great sucking black hole that keeps us from having federal level successes in guiding us through the pandemic and addressing the health of workers. Let's talk about just briefly some of the other places where we can intervene. And we know that there are there are businesses that that are well intentioned and want to do the right thing. There are industries that are well intentioned and want to do the right thing. Not all of them. There are bad dogs everywhere. But we do understand that there's an opportunity in the free market for there to be businesses contributing to solutions. And I also want to ask about labor unions and where do we think that the American labor movement can be contributing to some of the solutions that we need in both the near term and looking forward. And David, maybe I can pitch this back to you.
Well, look, in the short term, I think we need, for COVID questions, I think we actually have, the government needs to be supporting businesses much more than they are. I mean, right now, I think there's this bifurcation where there are some businesses that are doing very well and that can afford to put in protections and are doing testing and surveillance. And they're willing to invest in that because they for various reasons, they want to keep going. They're doing well enough or they care about their workers, but there are so many that aren't. And this is, I think you allude to this, there is this very clear link between the economy and public health. We can't separate them. And we don't want to disadvantage those employers who are doing the right thing. And so right now, I know that the government is spending some money helping schools, universities do testing, because we understand that young people who may not be so acutely affected by the virus when they're infected still can be spreading it, and that spread leads to other people dying. So the government is willing to put money into surveillance programs in universities. I think they should be doing this in workplaces as well. And at the same time, I think they have to be clearly supporting workers who, when they're exposed or infected, need to stay home so they don't spread the disease. And that money is about to run out, as far as I understand it, the money that was the sort of sick pay money. So in the short run, those are things I think directly have to come into play. In the long run, I'm hoping that out of this pandemic and this recognition that the importance of having a healthy workforce, we could really have this national discussion about what do we need to do to make sure workers are safe. And if it means that the price of chicken goes up by 10 cents a pound, I think the country can handle that to make sure workers aren't having their backs destroyed by chickens, by cutting chickens. And we need to think about how do we make sure we can do that and really raise things for everybody. Because right now, with the way this rampant inequality, there is this, as we've said, a race to the bottom, and there are a lot of people who are working more than one job and still barely getting by in fear for not having enough food for their kids, and putting themselves at risk. And it's wrong for them, but it's wrong for all of us. It's wrong for the economy. We need to really all get together and think about how we're going to change this. And it's going to require legislation, bringing up wages and giving people more rights. And hopefully that will also lead to stronger worker organizations who can demand those rights. And we'll see where that goes. But I'm ever the optimist. I think as we come out of this, we'll see a lot more recognition of the importance of these values.
Well, since you're an optimist, I want to pose a question that a dear colleague of mine, Angie Dart, has put on the chat on the Q&A. Dr. Michaels, what advice would you give to young occupational health and safety professionals to motivate them through this time as we move into the future? I think much of what we've seen in recent years and during COVID pandemic can be discouraging. We need these folks to want to work in civil service and continue to recruit into the field.
Angela is absolutely right. This is we've had a problem for a while of recruiting more people into the field. I like to think that's changing. I think first of all, within the federal government, we'll see both OSHA being given more power and more responsibility because it's so important, and other agencies as well. And certainly, I highly recommend a career of public service. I think it's the highest calling, and you could really have a good life and make a good impact. But the other thing I hear from safety directors of companies, not small companies, but middle-sized and large corporations, is they've never had such access to the C-suite, the heads of these organizations, because of COVID-19. I think that's not going to go away. So I think there also will be more opportunities in the private sector. I'm an epidemiologist, and in the 70s and the 60s and 70s and early 80s were the halcyon years of occupational epidemiology. OSHA and NIOSH were both doing really important work, and a huge number of companies, maybe not huge, but a large number of companies had in-house epidemiologists. And they turned out, some good studies, some bad studies, but there was lots of work for epidemiologists who were interested in occupational health. With the Ronald Reagan administration, when OSHA got cut back and NIOSH got cut back and studies stopped, all those companies dropped their epidemiologists. There was no interest in continuing them. And the area really was in crisis. And I think what we'll see, the opposite of that now. I think the need for industrial hygienists, for experts, not just in safety, but in health, who understand infection control in workplaces, will not go away. And I think it's because we'll see more government action on this, we'll also see more private sector action, and it can lead to a very good career, I think. And it's a particularly good time in some ways, because there isn't sort of this top-heavy group of people who will sort of dominate the field. There's lots of openings. It's really, I think someone can rise up very quickly with the proper expertise and attitude.
That was a great pep talk. I'll back it up with a little bit of preliminary data that, certainly our School of Public Health has seen a big bump in people applying, where Americans, I've heard it said, now know that an epidemiologist is not the same as a skin doctor. And Americans can spell PPE, right? So I think that, and we're seeing an increase in people inquiring about industrial hygiene programs and epidemiology programs. So, thank you for those comments, and it's reassuring. And I am an irrational optimist like you are. There is another comment. We have just a few minutes left, but I do want to make sure that we call out the issues that are being faced by teachers in schools. And our friend Bob Harrison has put this in the chat about reopening California schools, and how the act of having to find a way to protect the teachers as well as the students has an impact touching tens of millions of people across the country. He makes a comment about the need for resources and testing. Any thoughts, guidance? What would you do next if you could wave the wand for opening schools?
Oh yeah, look, it would be great for us to go back in time and tell governors that it's probably more important to keep schools open than to open up bars and restaurants, and that applies to the future as well. If you're going to reopen things, especially now that things are getting worse, figure out what's important. And obviously schools are important for so many reasons. Look, kids are losing, precious time that you can't make up. You can't, make up fifth grade the same way, and it's keeping many adults, out of the workforce, or in very limited ways in the workforce. It's a disaster. And so opening schools makes a big difference. So putting money into schools, both to increase ventilation and other precautions, and hopefully vaccinations when that's available, and testing and surveillance. I think all of those are really important. They're expensive, but this pandemic is expensive, and the cost of the pandemic is in the trillions. And if we do it right, we save money. If we can keep those schools open and safe, we're better off. And I think that's the attitude we have to take. We have to watch it carefully, but I think we need to be putting that money in. We've just made a down payment on picking up the cost of this pandemic, and we have to really put out some more money. And I think the folks in Congress, those who don't recognize that yet, really just have to swallow and agree to it, I think, because if they don't, we'll have a generation of kids who are set behind, and a generation of adults who are also set behind in the workplace. And it really is a disaster.
Matt, thoughts?
Yeah, I think you're absolutely right that we're looking at trade-offs here, and that the initial thinking about school closures was based on studies looking at snow days as a strategy, for pandemic influenza, and modeling, which suggested that they could be quite useful. But we didn't know much about COVID at the time. We know more about it now, and we should be clear that our knowledge is evolving around this. I think one of the problems we talked earlier about the challenge of moving someone off of a belief system that has become sort of integral to who they are as a human being. Um, and to the extent that things like school closures or things like masking have changing science behind them and also changing values behind them, we should acknowledge that and be clear about why we have changed the recommendations over time, right? So I think we're really paying today for the fact that early in the pandemic, the CDC said, you don't need to wear a mask, when what they probably should have said was something closer to, we need those masks for the healthcare system. Please don't buy them up. We don't know whether they do you any good or not, but please don't buy them up. Because that's what we actually knew at the time, was that we were going to be needing those masks within the healthcare system. Unfortunately, it came out as you don't need a mask. And then when later on we had to say, well, actually, you do need to wear a mask, you've got a whole cluster of people now who believe that the CDC doesn't know what they're talking about, and they change their mind, and this is all just mind control. We need to be clear about our changing valuations of different interventions. And the American Academy of Pediatrics in the middle of the summer was on the record saying this is a catastrophic decision potentially. And I think we should pay attention to that. And we did. I'm not saying that people didn't realize that this was a catastrophic, a decision with catastrophic consequences on both sides. But it behooves us to be honest when we are trading off risk, because there is no risk-free path through this pandemic.
Well, and Matt, if I can just insert here, some of that was being said and was being manipulated, right?
Yes.
Like quotes being truncated to say you don't need to wear a mask, and leaving out the half of the sentence that said, because right now we need the short supply for healthcare workers, right? So there was also a disinformation campaign that was going on. So it's complicated. It's not an accident that the most popular course I teach in graduate school is on public health communication, because we have been outgunned as public health communicators. And that has, I'm sorry to get on my own little soapbox here about public health communication, but that's been part of our problem. David and Matt, we're about out of time, but I want to give you each a minute for final thoughts and conclusions before we wrap it up today.
Well, it's easy for me to focus on the mistakes of the past, and I hope I didn't spend too much time on that. We have to learn from them, but this really is a moment where we have to sort of say, this is, it's the country wants a change, both around COVID and around worker protection, and this is the time to be bold and to push forward together, organizing, saying this is what we've learned from the past, and we're doing this to save lives, to make the country a better place as well. And that's really what we should be doing.
Yeah, and I'll reinforce that by just reflecting historically on what the decade after the 1918 pandemic looked like. Right? If you think about what happens in the wake of a catastrophic disaster like this, that is global, that is economic, that is political, that is health related, there is a little bit of a phoenix rising from the ashes sentiment that I think will happen as this pandemic winds its way down. There will be a period of tremendous energy, creativity, cohesion. I think all of that is is in the offing. I don't know if it's in this next year or 2 years from now, but we had the Roaring '20s coming out of the 1918 pandemic. And we are now entering the 2020s, coming out of another global pandemic. And I think there's a lot of reason for excitement and even, dare I say, optimism for the next decade.
Well, we're all grateful to both of you for your insights and for inspiring us to hang in there, wear our masks, participate in creating a better future for workers. And Matt Winia, David Michaels, again, thank you so much for your time today. And I also want to do a shout out to the Center for Bioethics and Humanities at the University of Colorado, and also to the Colorado School of Public Health, where the Center for Health, Work, and Environment has been a co-sponsor with Matt's group to put on this series. We will have future presentations in this series, and so stay tuned for announcements about the issues of pandemic, work, play, and ethics during COVID. So thank you all for joining us today. And with that, please be safe, wear your masks, be well.
Thank
Take
you
care,
so much.
everybody.
Good to see everybody.